Okay. Next, we're going to have Diane O'Malley come up, and Diane has really worked with us on creating a consensus decision-making group, and she's just going to briefly describe to you what that is.
Good morning. Can you hear me back there? Yes? Okay, I do have a little bit of a cold. So I have had the honor of working with this amazing steering committee, and I've just been really, really impressed by their dedication and their hard work. So when we started, we had to think about how will this group make decisions? Will we all raise our hand, and then we'll count? Oh, okay, 14 said yes, and 13 said no. What's that going to leave us with? 13 no's, I don't want to do that, and 14 yeses, I want to. So we felt like maybe there was a better way than just voting by majority. So we really worked with the steering committee to understand and embrace the concept of consensus decision making. So when you're going towards, as a group, when you're going to make a decision, rather than voting, and even the steering committee sometimes fell back to voting, right? Because we're all really accustomed to that. So rather than voting and having majority rule, you have a discussion, and if someone says, no, I don't agree, everybody gets a chance to voice why not, or how they might change that decision slightly. So someone might say, I agree with your first 4 points, but not number 5. Could we tweak that a little bit? Here's my idea. Someone else might say, yes, but how about we do it this way? And so it's until everybody may not agree 100%, but you say, I can live with that and really support that. It may not be 100% what I wanted, right? Because we have very diverse perspectives, but you've had your voice heard, you gave your contributions, you're sure that the decision reflects your concerns, and you can live with it and support it moving forward. And then the decision is made by everyone saying, yes, I agree. Yes, I agree. Yes, I agree. And if someone still says, no, I can't support that, you don't have a consensus decision yet. You need to have more discussion and maybe make slight changes until everybody's in agreement and you can move forward with that. Questions, comments? Anybody want to, our steering committee, want to add something to it? So I think the steering committee's thought and our co-chairs is that for any decisions that the council is going to make, and yourselves as members now of this council, that we would use a consensus decision-making process moving forward. It takes a little practice and getting used to, but remember, any decision made, you want to feel like you can walk out of here saying, I support that, I'm going to work for that. Okay, and if you feel, no, I can't, you need to say, hold up, slow down, how about did we consider this? Okay, so it's really a big responsibility on each individual to make your voice heard and to make sure that your perspective's included and you can support it moving forward. Stella, anything else?
No, that's good.
Okay.
Okay, we're going to have our first young lady come up to introduce the speaker for safety, and it's Miss Jillian Majutis.
Good morning, everyone. Good morning. I have the pleasure of introducing Ms. Lori Scott Pickens, who is our expert on safety, okay? Ms. Scott Pickens is currently the Director of Community Outreach and Community-Based Learning at the School of Criminal Justice at Rutgers in Newark. Recently, she was the Deputy Executive Director for the School of Criminal Justice's Police Institute, which served as the neutral convener for several community and law enforcement collaborations. Ms. Scott Pickens has an extensive background in community organizing at the local, state, and national levels, where she has provided consultation and technical assistance. She is the co-facilitator of the Juvenile Justice Reentry Initiatives in Essex County, where she is a member of the Youth Services Commission's multidisciplinary team. Ms. Scott Pickens has received numerous awards and recognitions for her work and holds a BA in Sociology from Montclair State University and a Master's in Public Administration from Rutgers University. So I present to you our expert to share with us and speak to us and motivate us to address issues concerning safety in Essex County.
Good morning. Good morning. It is so strange to hear somebody talk about you like that, right? And they asked me to present a bio, and I never think about it. I get the information in, and I never think about it until I hear somebody talk about me in that way. So thank you. You just made me feel better. You didn't cure my nerves, but you did make me feel better. I want to thank Ms. Lynn and Hazeline and Rhonda for inviting me. Those of you who I know in the room or who I speak in the room, I speak from the heart and experience. And I'm very passionate about this issue of public safety. I think it's extremely important. And so what I want to impart to you today are some things that I believe will help you in your neighborhoods around community safety, organizing, how to go about it. And I don't think you can ever get enough of that information, right? I think sometimes people think it's redundant. And, well, I heard that before. But every time you hear it, I hope that you gain a little bit more from hearing it again and get some helpful hints and tips. Because as an organizer myself, I always do. I don't consider myself an expert. I take that as a compliment. But I've learned something every time I come to a meeting or a gathering. So I just want to impart some things on you today. I'm also going to share some information with you about policing and the styles of policing. I'm going to talk to you about block club organizing and why that's important, because I see your issues here around safety, our community and neighborhood improvement, respect and communication within the village, community involvement, and public safety gang prevention. I'm going to show you some maps about the city of Newark. However, I do say to you that as someone who works in the School of Criminal Justice, I am familiar with these issues throughout the entire state of New Jersey, and in some cases the nation, because by virtue of my work I'm involved in the climate and the activity of gangs. And I think there are some perceptions and realities to what that looks like, even here locally. So I want you to be open in terms of what you perceive to be true, and then me sharing data with you about some of the realities. I don't have the current because I wanted to use it as an example, but there's current information around these things. And I also want to leave you with some thoughts about the people who are the most violent in our cities across the country is less than 0.5% of the entire population. Think about that for a second. So Newark has 227,000 people. About 1,500 people are the crux of the problems of the crime. There's a lot of other questions that can't be answered as to why can't we get control over that. A lot has to do with what we do as a village and community, and what we won't do, and what we're afraid to do. So I just want to impart some things on you, some basic ABCs of organizing. I'm going to talk to you about public safety and crime. I'm going to show you some maps, and then I'm here until you need me, Miss Lynn. Okay. I've been given permission to hang out with you. So I have a jump drive, and I need to put my presentation up.
All right.
Like the brake button. Yeah, that much advancing.
You want to dim the lights a little bit? I think I picked the wrong color, so some people might have difficulty seeing it. This is the yellow wall with the orange tag. I thought I was being cute last night.
Better?
Yeah, that's better. Did everybody see that?
Yes.
Okay. I'm like the other young lady. I don't like the microphone either, but I'm gonna walk you through this. And feel free to interrupt me, because I have got to tell you, with my years of experience, and I see one of my colleagues in the room, Miss Margarita Muniz, who I've done a lot of work with in the city. I have more experience than what these slides are going to give to you. So I encourage you to pick my brain and to ask me whatever you want about it. And if I don't know it, I know somebody who knows. But most of the stuff I'm going to share with you today, I do know. So what is community organizing? I mean, people hear that term, and I'm kind of a little jealous of the president because he made community organizing a big to-do when he got into office. While he was still in college, I was doing organizing here in Newark, in Vailsburg, when it wasn't a sexy term. But it's important that we understand what community organizing is. It's a process of building power through involving a constituency in identifying problems that they share and the solutions to those problems that they desire. So people working together as a constituency, as a group. You can't hear me. She's making me go to the mic. Okay. Is this better? Yes. Maybe I'm not Janet. I'll try somebody else. But. So community organizing is the process of building power through involving a constituency in identifying problems that they share and the solutions to those problems that they desire. It means working as a community with a group of people who have like-minded interests and would like the same desired results. And it's democratically controlled by that constituency that they can develop the capacity to take on future problems. So it shouldn't be event-oriented or just a one-time deal. It should be something that you're trying to sustain in the neighborhood. What is outreach? Outreach is an activity of providing services to populations who might not otherwise have access to those services. Key to outreach is that groups providing are not stationary, but they're mobile, that they are meeting those in need of outreach services in the location where those in need are. So it means you can't do it from the desk, the computer, from Facebook. It means you need to get up, get out, and knock on doors and find out what the issues and needs are. You're not doing outreach if you're doing it from a remote location. You have to look in people's eyes and their faces to see and understand what they feel and identify what their service needs are. What is meant by grassroots? Often associated with the movement is driven by community politics. The term implies that the creation of the movement and the group supporting it are natural and spontaneous, and I'll add in there organic. So it means it is the people who are supposedly at the ground level. I have my own take on grassroots about that grass needs to be fertilized, it needs to be mowed, it needs to be taken care of. And I often would like to encourage people to not think of themselves as being at the bottom that need that kind of nurturing, but think of themselves as an important part of the process because they're closer to the issues and the problems that exist in their own communities. The term was first used in 1912, incidentally. I think a lot of people think that that's a popular term from now. Not really. It goes back to 1912. Interchanging terms. It's important that you know when you're organizing and when you're doing outreach, you can perform both duties at the same time, but be mindful of your purpose and goals. Outreach to mobilize, you're trying to gain momentum on issues and problems, and you want people to work together. Outreach for services is based on what people need. And you should think of problems in your community around public safety as a service need. If there's no traffic light on the corner and 5 people have gotten hit, it's a service to have a traffic light on that corner. So think about outreach and services, organizing to address an issue or problem. As I said earlier, it's okay to organize to address an issue or problem, but think about sustainability and building momentum and kind of having that core group for as long as you need to have it. 10 rules of organizing. Nobody's going to come to a meeting unless they have a reason to come to a meeting. And none of us like meetings. My daughter, who is now a college professor and 31 years old, just got tenure at her college. At 3 years old, when she was 3 years old and I first started organizing, she said to me, "Mommy, your name is Lori Meeting Pickens." And my family is like, "You're always in meetings. Are you really always?" Yes, I go to meetings for a living. That's what I do. Whether it is in the morning, the afternoon, or the evening. So it's meetings. I go to meetings. But people are not coming unless they have a reason to be there. Nobody's going to come to a meeting unless they know about it. You can't assume that everybody knows there was no traffic light on that corner. So when the meeting is called, they're going to come because they know it's no traffic light on that corner, so they're going to come to that meeting. It's an organization does not grow, it will die. If you don't find ways to fertilize that, or mow that lawn, or take care of that grass, it's not going to grow. And you don't want it to grow too bad and become weeds, right? You do want it to grow. And you want it to look prime and green all the time. Anyone can become a leader. My mother told me if you can't learn anything, it's time for you to say, push up daisies, right? I can learn from anybody at any time. Anybody can be a leader. Our children lead us. Students lead me. I learn something from them all the time. Community people, I sat in this room this morning, I can tell you 10 things that I learned just from the preliminary parts of this discussion today. So anybody can be a leader, and anybody should be able to follow, should be able to lead and follow, walk aside, walk behind, should be able to do all of those. Those are key attributes of a leader, that you know when to lead and when to follow. The most important victory is the group itself, not any individual. Sometimes winning is losing. Sometimes when you get what you want, sometimes you don't feel happy that it happened, but sometimes when you win, you lose on certain issues. So you should be mindful of the fact that sometimes winning is losing. Sometimes winning is winning, and we all like that particular part of the business, right? We want to win, we want it to feel good, a win-win, but we need to acknowledge the other side of that coin. If you're not fighting for what you want, then you don't want it, right? You don't want it if you're not fighting for it. You should find something to live for and fight for it. And that's when you know that you truly want it. Celebrate. It is okay to have a party and acknowledge people and say thank you. We now have all of these tools in our computers to make certificates, to say thank you. We should always celebrate and say thank you to people, and try to make it as fun as possible. Hell, trying to get a traffic light on the corner where people have been getting hit, you know, that's sad. But the reality is, if you succeed in doing it, then it's something to celebrate, and you can try to have fun in the process. I say the traffic light, as an example, on the corner of, those of you familiar with Newark and Vailsburg, there's an elbow on the corner of Irvington Avenue that meets Norman Road, right by the church, right? People were getting hit, there were crashes, the streets were in the wrong direction. That's a county road because it runs through Newark and Irvington. It took us 2 years to get that traffic light. And it was worth it. But it was painful because people got into horrific accidents, and I think there was one fatality. But it took us 2 years because in that process, we had to document what was happening at that corner in order for the county to entertain a discussion about putting a traffic light up there. Collaborative problem solving. You know, this is a catchphrase term, but it's a very important one. You know, we need to think about trying to solve problems in a collaborative way. It enables residents and other stakeholders to play on an essential role in the problem solving. I like round tables because there's no heads. I don't like the long tables in the conference room, somebody sitting at the top. A round table says everybody has an equal say and an equal part. And it's always good when you can, to have food, because people are more calm when they're eating, they're chatting and chewing, as opposed to them looking all angry at each other about a particular issue, right? But I like round tables over the other kind. Everybody needs to have a task. You need to take on your task, and you need to come back and be accountable for that task. Everyone has an equal say. Everybody has a voice, and every voice needs to be heard. The collaboration holds itself accountable. When you're working on a project, we were working on that traffic light, we all had roles to do. I had to go door to door to see what the residents thought about it. The police had to be responsible for providing the data to say what was happening on that corner. The county needed to do their part about what it would take to set that traffic light up. Everybody had, the collaboration holds itself accountable. And there's a beginning, a middle, and an end to a problem. It is not good to be holding on to some issue forever and ever and ever and ever. Each problem that you take on should have a beginning, a middle, and an end. Steps to problem solving in neighborhoods. Assemble a core group, use them to monitor the progress or lack thereof, formalize the organization, set procedures for meetings and communications for making decisions, investigate, get the facts before you act. Never be led on assumptions that people are saying things are happening in the community. You need to get the facts. And hey, guys, if it hasn't been reported, it didn't happen. A lot of people don't like to report stuff. Everybody thought there was a problem on that corner with that traffic light, and nobody was reporting it, and everybody was looking at it, and everybody saw it, but nobody was doing anything about it. So you need to get the facts, investigate what it is the perceived problem is before you start taking action. Identify your top priority, what's the most pressing problem. Don't bite off more than you can chew. Little victories go a long way. So you have some success. Even convening a group and mobilizing is a small success. So you convene a group and then you move on. Conduct collaborative problem solving at meetings. Always are mindful of that being the structure. Divide the work. Make sure everybody has a role. Be prepared to adjust the plan. Things change, people change, situations change. People leave a community. There are elections, and you get new people in. As a grassroots organization or a neighborhood group or a project, you want to have sustainability. I don't have it in here, but you want to take politics out of it, because if the person that you're supporting doesn't win, or you make your group support a particular person and they don't win, well, what kind of climate is that going to be for your group as you try to move on, right? Identify a secondary priority and repeat the process over and over again. Rules for meetings, core group plans, and sets agenda. You should have agenda. You should always have an agenda. You should never let anybody hijack your agenda. You should always have an agenda. You should know what you want to do and what you want to accomplish. Arrive at a larger group as a cohesive. When you are a coalition and you are organizing as one and you have to deal with others, a bigger group. We in Vailsburg decided we were going to the county executive at that time. We went as a cohesive group together in order to work with the county at large. Set ground rules for meetings, divide the work, formulate a plan, a security plan, agree on a process for making decisions, try to stick to the agenda. And I noticed something real important here this morning. Ms. Lynn came up to this microphone, this one, right? She came up to this microphone this morning at 9:29 and said the meeting will start in 1 minute. And it did. The most important thing you can do in organizing and being involved in the community is to start and end on time. Now, there's no such thing as that rumor about CP time, because I've been in meetings with white, green, purple, yellow people, and people have this like cushion that they allow, that 15 minutes, that is some crap and donkey dust, right? The fact of the matter is you start and end on time. Doing that will give you so much respect. And I'm one of 12, I'm in the middle, and my mother used to have seasons where she purchased stuff for us, right? Because there were so many of us. At any given time, there were always 7 of us at home. For those of you who are Norkers, you know that Bamberger's used to be on the corner there of Market and Halsey. There was a big clock on that, right over top of that corner. And my mother would tell us, it's your time for shopping. Be here at 4 o'clock. If we got there at 4:01, she was gone. We don't know where she went. We don't know if she disappeared in the store. But her decision to make us be punctual was very, very serious. And so we all, I didn't get a coat one year. The coat that I wanted. She didn't let me go out in the cold. I just wanted something new because I was in high school. Right? But I didn't get one that year because I got down there at 4:15 because I was BSing with my friends. And she said, I told you 4 o'clock. Next, your turn will come up in the next, after your sisters and brothers. I had to wait 2 people to get it in. Other important topics, working with the media. Be careful about the media. Now, this is my own little pet peeve. I'm going to share this with you. This is just my thing. I'm not telling you to do. I don't like the media. And I'll tell you why I don't like them. I don't like them because we use them as a means to an end. But if we're not giving them something salacious, right, they're going to edit what we say, or they're not going to even run the thing because it's not good enough. The media, in my opinion, I don't trust them. I don't like them. But I think people use the media sometimes to grandstand, and you got to be careful about that. Know how to use them and use them wisely and use them carefully. You should take surveys, something about knowing the facts before you act. Even if you do it among a small group of people, you should be trying to figure out what the climate is. Take a survey about what the issue or concern is and then tally up. I mean, you could do something very simple, you know, a check off yes and no, how many yeses or nos did you get? I really learned something else too about consensus building. Really important about, I agree with these 3 things, but I don't agree with these 2, right? If you take a survey, that'll kind of help you judge the climate. So, you know, use that as a tool. And I think people don't call on the School of Criminal Justice or Rutgers enough to help them do simple things like taking surveys or data collection or things like that. I'm not telling you to call me all this afternoon about some data. Set ground rules for meeting, divide the work. Some of this stuff is redundant. Agree on a process for making decisions and all of that, okay? Other important topics. Youth organizing, fundraising. I don't like to ask people for money, so whenever there's a fundraising activity, I always get in trouble because I don't like to ask people for money, but you know, sometimes you do have to fundraise, whether it is to put a jar in the middle of the table and say, people put what you can in there so that we can have coffee from Dunkin' Donuts, or we need posters, or we need to run off some flyers. You have to find a way to do fundraising. And when you're good and when you're organized, there are a bunch of foundations in the immediate area that will fund small projects. And so you should get to know who those people are so that you can take and fund some of the activities. And they like doing grassroots activities. I'm talking about $10,000 or less for you to do the things that you need to do to mobilize in the community. So community policing, right? The police are the community, and the community are the police. That was first said by Sir Robert Peel. He was in office in London from 1841 to 1846. What does anybody think the police are the community and the community are the police means? Anybody have any idea what that is? I see a hand in the back.
I'm going to take a guess, but do you want your police to represent your community and your community to be tied in with your police? So it's like, it should be your police should be a group of, make up of your community so that everybody works together kind of deal.
So, yes, sir.
Just to piggyback off that, I would like to say that that's the organization of people who are to protect the community, to be involved and active, while the people that actually live in the community will also be just as involved and active.
Okay, I saw a hand in the back.
I think back in that time, that was when the police, it was more active and passive representation. So not only did the police look like the people they serve, but they came from the same community, and we don't really have that in our community. We have people coming into our communities now who have no attachment to our community.
So my pushback to that is going to be, is that true? About that, the community policing, it means it should reflect the community. What it means is that the community has just as much of a role in the process of policing as the police do. And so community policing is a set of activities where the police and the community are doing things together. PAL, the Explorers Program, block watches, those kind of things. I've been given my 2-minute warning, so I'm going to ask anybody who's filming me at this point to stop doing it.
Our next speaker will talk about education, and they are going to be introduced by our recording secretary for the Essex County Council for Young Children, Tanisha Garner.
Good morning, everyone. I'm here to introduce Ms. Cynthia Rice. She has been a staff member of ACNJ for 21 years and a senior policy analyst since 2002. Her work has included identifying, monitoring, writing, and advocating on critical policy issues in early childhood education, especially in areas of New Jersey state-supported preschool programs and in the and alignment of pre-K-3 systems. Ms. Rice earned a Juris Doctor from Pace University School of Law and a bachelor's degree in economics and government from Georgetown University. Prior to ACNJ, Ms. Rice spent 3 years as an assistant district attorney in Bronx County, New York. Thank you.
Good morning, everyone. It's so nice to see so many parents. You know, the work that we do at ACNJ, first of all, maybe that's a great place to start. How many of you have ever heard of Advocates for Children of New Jersey?
Thank you. ACNJ is here right here in Newark on Halsey Street, and we've been around a long time. We're the largest multi-issue child advocacy group in our state. So while we're located here, we do work throughout the state, and we handle issues everything from early childhood and education in general to child welfare, juvenile justice, health issues, all of those issues, any issues that affect children and families, both within this city and in our state. But you know what, we're just really one voice. And there are other groups. I see my colleague from SPAN here. There's lots of other groups. But really, what makes the difference is strong advocacy from parents. And I can tell you that the parent voice is not nearly loud enough. So I am so happy to be talking to you interested parents who are willing to be advocates. So I'm the education person here today. And I thought I would talk about 5 issues. I often don't like PowerPoints, so I thought I'd hand it out instead so that you can see it and you can take it with you. Unfortunately, I can't stay because I have another meeting, so I want to make sure that you have something tangible. But I'll tell you right now, please do not hesitate to email me or call me. And my email and number are on the back. So please do that as you move forward with the work that you're doing. So I have 5 very concrete areas that I think you may be interested in. I'm going to talk about the problem in each one, and then some things or some steps that you might consider taking as either individual parents or individual citizens or as a group. So let's start out. Lots to talk about. First of all, I want to talk about chronic absenteeism. Anyone think it's a problem? Yes. So, it's not rocket science. If any student, regardless of age, I know we're focusing on 0 to 8, but any student that's missing too much school is going to have an impact on what they're learning and their ability to be successful in the future. It's particularly difficult and a problem for young children. Why? Because we're laying the foundation for children to be successful in school, both academic and socially, right? So we know that's why we have preschool in 4 of the cities and 4 of the towns in this county alone. And when they're not coming to school, it impacts a great deal. So it affects long-term, their reading skills, their social and emotional skills, lower test scores. So you see the need. You've got to be there, right, to be learning. But we've got a real problem in this county. First of all, in the state, there were 33,000 kindergarten through 3rd grade students that were considered chronically absent in 2013-2014. What does that mean? That means those 33,000 children were missing 10% or more of the days that they were enrolled in school. So if they were there in one school for all 180 days, they were missing 18 days of school. That doesn't mean 18 days in a row. That comes out to about 2 days a month. So you're seeing lots and lots of kids, 33,000. When we look at the numbers in our communities, so for example, Newark, 28%. The 33,000 is 9% of the total number of kindergarten through 3rd graders. That number in Newark is at 28%. That is almost more than 3 times the state average. It's about 4,000 kindergarten through 3rd graders in Newark alone. Similarly, East Orange at 23%, Irvington at 20%. Now, we released 2 reports in September. One was a statewide report that has all the data. The other one was a report looking at the early learning years in Newark. And this is where we have this data. But we just didn't include the numbers, which are important, but they were not the whole story. We had focus groups with parents. I'm looking around to see if any of you were at the focus groups. I knew you. Oh my goodness, yes, that's right. And we said, so why are kids missing so much school? And the reasons vary pretty significantly. It could be transportation. That's a huge issue. It could be safety. It could be weather. It could be health. We have a huge asthma problem in this city. And so how do we handle that? And so a lot of parents feel, I send my kid on a rainy and a snowy day, they're going to be out 3 days. We have a real lack of support between families. So if one child misses school and I'm living in a neighborhood that I don't know anyone, I can't take that sick child out, so I'm going to keep all my kids home. We heard that over and over again. So all of these are pretty significant issues on why these numbers are so high in this city. But also, I would assume that these problems are reflected in many other communities, not only in this county, but within the state. That kind of reflects why the numbers are so high. So, I just want to mention one last thing. One of the things that the parents brought up was because preschool and kindergarten, oh, by the way, the preschool number, there was no numbers for the child care centers in Newark, but we did have the public preschool classrooms. The number was 40%. So we felt it was not fair because we did not have all the data. But you think about that. I don't think it's going to be too much different in the community provided. 40%. We're providing high-quality preschool in this community, communities throughout, actually 4 communities in this county, and so many kids are missing. And what did the parents say? It was because the state doesn't require preschool and kindergarten. So if they don't think it's that important, it's okay to miss a couple of days here and there. It's not okay. So clearly, here's something. That message is not getting through to parents. That every day, whether you're 3 years old or whether you're 15 years old, is an important day because learning is going on. So that's the first thing you might think about doing. How do we develop a campaign to work on ensuring that parents know how important coming to school is every day? There is a bill, a piece of legislation, both in our state assembly and our state senate. And a piece of the bill, it's a great bill. The piece first defines chronic absenteeism. Remember I gave you that definition about 10%? That we don't have that in law anywhere. So that would define it. And it would require schools to actually report their chronic absenteeism numbers. So you as a community member or as a parent could say, okay, my school is at X percent. You would know that. And the third thing was, the bill says if you're at 10% or more, if you're a school and you have 10% or more, and in this city that'd be a lot of schools, you have to come up with a coalition that includes parents. You know what the problem is? There's pushback because there's an issue about parents being on that. So when the bills are up, we need parents to testify. You need to be part of that conversation. We're not talking about private children's, we're not talking about individual children. We're talking about big picture. So why is this school having problems? So the example I gave about preschool and kindergarten, that's not one kid. That's not identifying one child. It's saying, as a whole, we've got this problem. We need to talk about how can we do that better. A parent gives a very different perspective. That information about, if the state doesn't think it's important, that came from parents. It didn't come from school administrators. You see the difference? So we need parents on it. So there are 2 concrete things. A campaign to tell parents how important it is for children to come every day, and to support bills that make sure that parents' voices are at the table when particular schools are really struggling. Okay. Now let's go on to the next one, and this is preschool access for all. How many of you live in East Orange, Irvington, Newark, or Orange? Okay, maybe it's better to say, how many of you don't live in those? Right, terrific. So in those 4 communities, you have high-quality preschool. Every child can participate in high-quality preschool. It's a wonderful thing. But in other communities, I saw a group of hands where you don't have that access. And so what happens? Well, children are coming to school in all different levels of readiness, and they don't have that. So why is it that right now our funding formula for schools would allow for low-income children throughout the state to participate in what these 4 communities already have? The problem is it's never been funded. So a couple of really good things are going on. First, there's a campaign called Preschool Our Way, Pre-K Our Way, that's trying to bring attention to this issue, so that's a great thing. If you want to learn more about it and want to support it as a group, as an Intivia group, go to Pre-K Our Way, oh my goodness, I think it's .org. But if you just Google Did you ever notice how we all do this? If you just Google pre-K our way, you can find out about it. So that's one thing. And there are 2 bills. That's one of the reasons why I have to run back, because 2 of the bills are up next Thursday, and they're very, very different, to expand preschool. There'll be a lot of people, you know, with suits on and, the regulars, the usual suspects that'll be testifying at that hearing. How wonderful would it be for parents whose children are either benefiting from high-quality preschool, state-funded preschool, or who are not, to talk about what does that mean to them and what does that mean to the future of their own communities. So that's another concrete thing. So pre-K our way, and to support legislation that is up. Actually, it will be before the Senate Education Committee. Now, I know it's Trenton. It's a long way, but there are lots of ways other than showing up that you can let your voice be heard. Okay. Third thing, school breakfast. You know, food insecurity in our state in general is real. It's a huge, huge problem. The number of low-income children who have qualified for free and reduced price meals jumped 19% in the last 5 years. That's a lot of kids who are experiencing food insecurity. We know that when kids haven't had a good meal, what happens? It affects academics, social and emotional, all of those things. So, there are right now 32,000 children in Essex County that are eligible for school breakfast, but they are not getting it. You can go towards the back. We have the list. I know I see it 5 minutes. Oh my goodness. We have the list of where your community is rated. Look at that. If your numbers are high, please, please, please get in touch with your community and say, we want breakfast after the bell implemented in our schools. That means when a kid comes in, they're getting the meal while they're taking attendance, while you're listening to the announcements, and they're having a healthy breakfast. It is working so much better than when it's offered in the cafeteria. Because kids, it's not their fault that they're not there, right? It may be the bus, it may be, a parent is late. So we want to make sure they're eating. Next thing, putting children's safety first. Right now, you have about 275 registered child care homes in Essex County. Right now, those providers and their families who are in the house do not have to have criminal history background checks. This is a problem. Why? Because so many of the families provide care for infants and toddlers, children who can't speak up if there's something going on. Now, 99% of the time, nothing is happening, only support. But we want to make sure our most vulnerable children are protected. There is a bill in the Senate that went through that would require that criminal history background check. It's stalled in the Assembly. That's another thing you can do. When the bill comes up, and we can keep you informed when that's coming up, having parents say this is the right thing to do for kids. And the last point of the content is encouraging lifelong readers. Reading to kids doesn't begin in kindergarten. It has to begin at birth. And families don't always know that. And there may not be books in the house, but there are libraries. So talking about that message is key. You are the ambassadors for literacy. You need to talk about this. So getting behind that, maybe a campaign about the important things. So a couple of things you can do. First of all, sign up at ACNJ, acnj.org. A good advocate is an informed advocate. You will get information all the time. It's free, and you will learn about all of these issues. I brought up 5 things, but for any of the areas that you need to handle, identify an issue that you want to go forward with. Look at the data, and has anything been written about it? So for example, in early childhood, oh my God, there's been so much written about the importance and why it's important for children. Learn about that. Figure out what your result is. What is it that you want to accomplish? And everything should work towards that. There's power in numbers. It's nice when there's one of you. Everyone should have their voice be heard, but it's also important when there's a lot of you. Make a plan and don't be afraid. I think that that's a problem because this is not something people are comfortable with. You think you don't know, or legislators know more than you. Here, we should turn it off right now. More often than not, they don't. You are the experts. You know your children, and you can understand an issue better than anyone else. So don't be afraid. What could be the next steps? First of all, identify who you need to talk to. So for example, if you're talking about chronic absenteeism, and you're talking about the bill, you've got to talk to your state legislators, right? Because that's where the bill is. It's in Trenton. But if you're talking about what can we do as a community, you may want to talk to the school district or the city. I saw pictures of on YouTube of a mom taken 3 days after the snowstorm in front of a school that street had yet to be plowed. What's the connection between the city and schools? Can that be a conversation she made her voice heard on YouTube, but where did it go? Those types of connections are key. Do your homework. Be the expert. Don't be afraid to make appointments with your legislators. They represent you, and your story is about their constituents. All politics is local. They can talk about things on the state level, but when you say, this is how this has affected people in your community, it makes a huge difference. Don't be afraid, and don't worry about being a nudge. Sometimes I talk to people on advocacy, and they say, well, I wrote a letter, and I didn't hear from anybody. Well, you know what? Welcome to my world. That happens all the time. Be a nudge. A good advocate is a really good nudge. So you don't be disheartened. Be patient. Be strategic. Be intentional. Be patient. It's the only way to focus on what you want to accomplish. So thank you.
Okay, at this time, we are going to bring up Ms. Hazelyn Pilgrim. She is the co-chair of the Essex County Council for Young Children, and she will introduce the speaker on health.
Thank you, Monique, and good morning, everyone. I am just personally so gratified to see so many parent leaders in the room. My task is to introduce Dr. Pamela Clark, who is the President and Chief Executive Officer of Newark Community Health Centers, Incorporated. Dr. Clark is well experienced in finance and has leadership responsibility for a network of 7 ambulatory care centers in the greater Newark area. She's well versed in day-to-day operations of community health centers. And under her leadership, the community health center movement has flourished in our community. She's committed to Newark Community Health Center's mission of providing affordable, quality health care to the medically underserved population. Newark Community Health Center has a well-established presence, serving as a healthcare resource for prevention and the amelioration of health disparities in the state of New Jersey and in Essex County. Newark Community Health Center has been awarded Level 3 NCQA Patient-Centered Medical Home status in 2011 and is recognized as one of the largest providers of comprehensive primary care for the uninsured and medically underserved populations in the country's most densely populated cities. Through this network of health centers, Newark Community Health Center is responsible for offering primary care, psychosocial services, and behavioral health management to over 39,000 patients who account for over 147 visits in fiscal year 2015. So without further ado, I present to you Dr. Pamela Clark.
Thank you so much. It's a delight to be here today. And I don't think I need this microphone because I think my voice carries and you all can hear me. I think it's an awesome crowd to see each and every one of you here because it shows that you care. You live and you work in an environment and you want it to be safe and also to provide services for yourself and your family. So thank you very much. Newark Community Health Centers. Have you heard that name before? How many people have heard the name before? Raise your hand. I'm going to put you to a task. How many have used the health center? No, I have to talk. I have to talk. You see how many raise their hands that they know about us? But how many of you have used it? that is why I'm here. And that is why you're here, because I'm going to tell you some information which is very, very important about healthcare. First and foremost, we are federally qualified health centers. And what it means is that we are mandated by the federal government to open our doors to provide primary care service in underserved communities. And when we talk about underserved communities, we're talking about areas where there is a high disparity in healthcare. Now, I don't like to use all those words with disparity and all those fancy words. What it means is that when there's an area where there's a large number of people living in an urban setting, and their challenges are different, which means that you don't have access to health care, or you don't have access to transportation, or you truly don't have access to get to a doctor when you need one, then that's an underserved community. And that is why we're here today, because we have to look at where we live and what do we have. And so what I'm going to tell you is, I'm glad you all raised your hand that you know about the Newark Community Health Centers. There are 7 sites that are located in Newark, East Orange, Orange, and Irvington. And I'm sure all of you live in those areas, right? Yes. And I've seen some people work with us too. Very good to see you. Fantastic. So what it means is that we are making an effort to establish health centers where you need it, where you have access to care, which means you can get on a bus and you can find us. One of the things we're trying to do is to make sure we have all of the services you need in one place. So what you'll find when you go to the health center, you'll find a doctor for adult medicine, or maybe you want to call it internist. When you get there and you take care of yourself in adult medicine, you may find that every once or twice per year you need to do your PAP, or you need to have your annual checkup with an OB/GYN. You're going to find one there too. Now, while you're doing that, you have your children. And your children have to be cared for while you take care of yourself. And so at the health center, we also have pediatricians. So it's called a one-stop shop, because no longer can you say that you don't have access to health care, or you cannot find all the service in one place, because that is what we're doing for you. Your responsibility is to ensure that you know where we are, but most importantly, tell other people about where we are. Then you must also tell us what it is that you need that we're not providing to you. Very important. Now, most important piece that I'm going to talk about has to do with 2 things. And I have some statistics here for you. I know I have 15 minutes, and I know you want to ask me lots of questions. But this is a challenge that all of you face in this community. Statistics now. And I'm not going to give you too much, but I'm going to give you the key ones. 40% of women in Newark receive late or no prenatal care, compared with 20% statewide. Did you hear that? Should I repeat it? 40% of women in Newark receive late or no prenatal care, compared to 20% statewide. Yes, you can ask. It's okay.
Okay, so I'm just curious how that is still the case considering the Affordable Care Act, which is where they're supposed to create a lot of access to health care. I don't understand.
I'm going to answer that question. Can you hold it? All right. Now here's the other one. 10.5% of Newark babies born with low birth weight, compared to 7.9% statewide. I'm going to repeat it. I have 15 minutes, but I'm hitting the key points, right? 10.5% of Newark babies are born with low birth weight, compared to 7.9 statewide. Now here's the worst one. Infant mortality in Newark is 10.8. I don't have a 0.8 person, but there's 10.8 per 1,000 live births, compared to 5.1 statewide. So statewide, infant mortality is 5.1, and here in Newark is 10.8. We have some serious problems in Newark. And I'm going to tie it to what you just said. What is happening to our young people in Newark. What is it do they know or they don't know when it comes to taking care of their lives? What is it? There you go, yes?
They're starting too young to have kids and don't know.
People might say they're starting too young to have children. And that may be true in some households and it may not be true in other households. But the fact that they're living in households where they have moms, right? Normally we find the dad is not there, but when it comes to women's health, it's always the mother that gives guidance. It's always the mother that passes on the message. It's always the mother that rallies around her young children when it comes to childbearing age and taking care of children. So that's a very good point. But it's also something we need to consider. Here's another one. Lack of knowledge. That's a good point too. But how can there be lack of knowledge when everybody now has access to the internet and your fingers are going like this? Am I right? Does everybody have a phone? And everybody's connected to the internet and they're doing this? So, is it lack of knowledge? What is it?
Desire.
The desire?
To want to get that information.
The desire to want the information. Very good point. Yes?
A lack of concern.
A lack of concern about their bodies or about their life?
Both.
Both. A lack of concern about their bodies and about life. Very good point. Any more? Yes? We're here to help each other.
But sometimes people don't know what they don't know. Right. So, I don't know, I mean, I'm listening, but I don't think that anyone intentionally, you don't know, if you don't know something, you really don't know where to go or just kind of moving through surviving.
So if you don't know what questions to ask, you don't know what to do, you don't know where to go to ask, and you don't know who to ask. Very good points, because all of this are issues that you have got to address and think about in this session and to make some decisions regarding how we're going to overcome this.
It's a continuous cycle. If the mom hasn't taken care of herself, it's not going to trickle down to her children. And so mom needs to work on educating the head of the household as to what, and this is why these programs are so important.
So we call it a vicious cycle, right? Mom didn't know, or mom did it that way, and so what happens? The young girl do it just the way she saw mom do it, or how she saw the neighbor next door do it, and so that's how she do it. Very good point. Yes, I'm coming, yes.
I was going to say sometimes they're afraid that they're going to be judged because they also be private. So being afraid and embarrassed as well.
Fear and embarrassment about being pregnant. With lots of knowledge about sex. Fear and embarrassment about being pregnant, but nothing to do with sex. No fear and embarrassment about sex. All right, put it in perspective now. Hold on a moment. Here you go. Lack of motivation and awareness. Lack of motivation and awareness. Lack of motivation of the woman or the young man. Awareness about themselves, who they are as a people. Is that what you're saying? And it wasn't taught in the home, so they're not conscious? Is that where you're going with this?
They're not conscious about the opportunities or because of the medical disparities that exist, that they do not see, some people do not, go and see. Plus we have people with, I always talk about mental, we have people with mental illness.
Very good point. I'm going to take one more, because do you know you're addressing all the issues right here? One more.
Okay. I was going to say, it is the distrust of the medical system, and a recent report in the Atlantic magazine actually still showed that primarily white doctors, they're still treated differently, not diagnosed as orphans or misdiagnosed more so than their white patients.
I would like to continue on that discussion, but because there is a hand here that hands, I'm going to take just two last, but I want to continue on what you just said. Two more, because you're all answering the questions and you're all telling me the things that we need to look at as healthcare providers.
A support network.
No support network?
Your support network. I think that would make a difference. The support network.
Did you hear that?
Yes.
Okay. Good point. Just one more, because you're leading my presentation and you're answering all the questions. Yes.
The other issue is sexual abuse. It's a big issue. If you're a person that's being sexually abused, that in itself is a self-esteem problem. Additionally, you're not necessarily going to come forth a lot of times. They make you wait too late to even address that particular issue. The other issue is that we have a high population of Medicaid patients in the city of Newark, which is not being addressed. And a lot of people, because they have Medicaid, are being treated in inhumane ways to the degree that it's very embarrassing for them to even go to a doctor. A lot of doctors and hospitals are also turning them away as well. And they're not informed with what their rights are as a patient and what the responsibility is from a physician standpoint as to what to expect, especially under the new Affordable Care Act laws, which is very confusing for a lot of people, particularly if you're a Medicaid patient and just out there on your own without some guidance and support. That is a huge problem, and I think if that is addressed in itself, it would really create a better opportunity for more people who feel comfortable going to a doctor. Medicaid discrimination is a problem.
You have all raised the issues that we're faced, not just in Newark, I say Newark and surrounding communities. You've just raised all the issues that needs to be addressed. Now the question is, what is the largest FQHC in Essex doing about it? That's the question you're going to ask me. What is the largest FQHC in Newark doing about it? And the largest FQHC is Newark Community Health Centers. So here is what I'm going to say to you, because you need to know this, and then you're going to talk to me again to tell me what it is that I'm missing from this presentation. First and foremost, Newark Community Health Centers have been serving this community for 30 years. And in 30 years, we've established 7 sites in different locations. And we talk about where to go to get that information because it's on nchcfqhc.org, and I'll tell you it again. But we are in several locations. Since we have established those locations, we have created a model for care, one of which is that we hire board-certified clinicians to see our patients. We recently introduced the use of nurse practitioners because the way how nurse practitioners work is very different from an MD. A nurse practitioner focuses on more case management of a patient as opposed to an MD that focuses directly on the disease and the resolution of the clinical issue, as opposed to a nurse practitioner who asks questions to address other elements than just the physical disease. And so what Newark Community Health Center has done is that we are now looking at a type of care called population health management. What it does is that we take care of a patient based upon the whole being. We look at the physical, which is the body, we look at the mental, and we look at the social issues around the patient. So what we do, we hire board-certified clinicians, we have case managers working in the health center, we have different kind of doctors to take care of whether you need to see the pediatrician, you need to see the adult medicine doctor, you need to see OB/GYN services, and most important, dental services. We have licensed clinical social workers there because a lot of our issues that we face is not just a disease, but they are social issues. The doctor says that when a patient comes in front of the doctor, what do they talk about first? It takes 45 minutes to hear the person tell them that their son didn't come home last night and they don't know if they're dead on the street, they don't have money to pay for food, and they're going to be put out of their homes by the end of the week. That is what is making our people ill. And therefore, NCC has added to the service mental health counselors, licensed clinical social workers, and we have retrained our clinicians to address those issues. Now, we're making every effort to be in the community for you guys. The question is, are you coming? Are you coming? I have 1 more minute, but I'm going to say this, and that is the issue right there. We are there for you. We have extended our hours of operation from 9 to 7 p.m. Monday through Friday. We're open on Saturdays 9 to 5. And last year we opened up 7:41 on a Sunday from 9 to 1 o'clock. Where are you? Where are you? And so the question that you need to ask me is, am I doing enough to educate people in the community to let them know that we're open and we're there for service? Is that the missing piece?
Yes. Yes.
Okay, but I'll take responsibility for that. I'm going to do more advertising. But are you going to come? Because between 5 to 7 p.m. across the sites, there are about 2 or 3 patients sitting in the waiting area. I have very expensive providers waiting in the back. And across the health center, between 5 to 7 p.m., the number of patients waiting to be served is very, very low. On Saturday, it looks like a ghost town at some of the health centers.
My daughter, she went to the health center on Saturdays with the dentist.
Yes.
Yeah.
And was the service good?
She was in and out.
There you go, in and out. And why? Because the wait time was low because people aren't coming. So, okay, so I have 1 minute and I have to wrap up. But did I tell you enough about what the issues are that's being faced, or you told me? And I'm telling you what NCC is doing in response to it. So I'm listening to you and I'm hearing this connection. But the most important thing is, how is it that we have such a facility available? And quickly, to answer your question, every year for the Affordable Care Act, we certify 54 people in the health center who are trained to educate and enroll people into the insurance that they can afford. And if they don't fit in or qualify for the exchange, insurance on the exchange, we have people trained to register people into the New Jersey Family Care program. And if you don't qualify, we have people at the health center who can give you the paperwork for you to get charity care from the state of New Jersey. So we are doing our part. We have events in the community where we invite people to come, and when you go to that event during November to January, we have people with laptops, because you know people like to use their phone, and they have their laptops to register you into the various program, health insurance program. But on top of that, guess what we do? I'm going to wrap up. We have the system open to schedule an appointment for you right there. All right? I'm going to end on that note because my time is up. Yes.
So I was just saying that our table, where we talked about folks going to the emergency room. Because they go to the emergency room, they're not going to be turned away. That's been a practice in families, and that's what they're accustomed to. So, yeah, educating them.
Changing the mindset that you must connect with a primary care provider, establish a relationship, go once or twice per year for your checkup, just to keep you healthy. And if on your checkup you find out that you have diabetes, hypertension, you know, then you maintain that relationship with the provider and you come back to manage your health. But not only that, remember, Newark Community Health Centers cannot turn away a patient because they have no money. We're obligated to see you. You can schedule an appointment, and if you walk in, all we ask, just wait. Just wait. Why? Because if you walk in and somebody already have an appointment and we say we're going to see you, you only have to wait a little while, right? And don't grumble, just hold on, because we are going to see you. But the most important thing, what she said, is this, that not only do we have the service to prevent people from going to the emergency room, but we have, or we did, what's called an ED diversion program, emergency room diversion program with Beth Israel. And what we did is that we have a direct relation with Beth Israel. And with all the hospitals know that for anybody that goes to the emergency room and it's for a cough or for a cold or for something that is really primary care, shouldn't go there, they send your information to us. And we're supposed to call you. No, we are doing that. But do you know what happens to most of the call? People hang up the phone. And maybe it's distrust. So what we do, we get people that speak Creole, because we do have people who speak Creole. Yes, I'm out. We have people who speak Spanish. We have people who speak different languages. Why? So that when you answer the phone, we're going to respond in your language so you don't hang up. But still, people hang up. So thank you.